Hey everyone, Dr. Mike here, and if you're feeling unusually tired or noticing subtle changes in your body, it might be more than just daily stress. We often think of diabetes as a straightforward diagnosis, but it can be sneaky, especially for women. Diabetes often manifests with unique signals in women that can easily be brushed off. In this video, we'll dive into 8 common indicators that suggest diabetes might be lurking in the background. Understanding these signs is the first step to taking control of your health. So let's dive deeper and empower ourselves with knowledge. So, let's talk about PCOS, or polycystic ovary syndrome, a hormonal issue that affects many women, often during their childbearing years. It's a condition that can have a wide range of symptoms and effects on a woman's body. Now, you might be wondering, what does PCOS have to do with diabetes? This is a question that many people ask, and the answer is quite revealing. Well, the connection is closer than you might think. In fact, understanding this link can be crucial for managing both conditions effectively. PCOS often messes with menstrual cycles, sometimes causing them to be irregular or even absent for several months at a time, and can even lead to excess facial and body hair due to higher levels of male hormones or androgens. This can be quite distressing for many women. But here's the crucial part. Many women with PCOS also deal with insulin resistance. This is a significant factor that ties PCOS to diabetes. Insulin is like a key that unlocks our cells to let glucose or sugar in for energy. When this key doesn't work properly, it leads to various health issues. With insulin resistance, the key isn't working properly, leading to a buildup of glucose in the bloodstream. This can cause high blood sugar levels, which are harmful over time. This overload can actually push the ovaries to produce even more male hormones, exacerbating the symptoms of PCOS, further increasing the risk of developing type 2 diabetes. This is why monitoring and managing blood sugar levels is so important for women with PCOS. It's a bit of a vicious cycle, but understanding this connection is vital for early intervention and management. By recognizing the signs and symptoms early, women can take proactive steps to manage both PCOS and diabetes effectively. Let's be honest, yeast infections are never fun. They're itchy, uncomfortable, and can really put a damper on your day. But what if I told you that frequent yeast infections, especially those that keep coming back, could be a sign of something more serious like diabetes? You see, yeast thrives on sugar. When there's excess sugar in the bloodstream, like in the case of undiagnosed or poorly managed diabetes, it creates a perfect environment for yeast to multiply, leading to those pesky infections. This is particularly true for vaginal yeast infections, as the vagina becomes more susceptible to yeast overgrowth when blood sugar levels are high. So, if you're noticing a pattern of recurrent yeast infections, it's crucial to bring it up with your doctor. It might be a sign that your blood sugar levels need some attention. Urinary tract infections, or UTIs, are another common health concern for women. But did you know that they can also be linked to diabetes? Here's how it works. High blood sugar levels, a hallmark of diabetes, can create a breeding ground for bacteria in the urinary tract. When there's excess sugar in the urine, it acts like fuel for bacterial growth, making it easier for infections to take hold. This means that women with diabetes, or those with consistently high blood sugar levels, might find themselves dealing with more frequent UTIs or infections that are harder to shake off. It's like a domino effect, with high blood sugar tipping the scales in favor of those pesky bacteria. So, if you're experiencing recurrent UTIs, especially if you have other risk factors for diabetes, it's essential to get your blood sugar levels checked. Our skin often reflects our inner health, and sometimes it can give us subtle clues about what's going on inside our bodies. It's like a window to our internal well-being, showing signs that might otherwise go unnoticed. When it comes to diabetes, one particular skin change to watch out for is Acanthosis nigricans. This condition can be an early warning sign, alerting us to potential issues with our body's metabolism. Now, this might sound a bit intimidating, but it's basically a skin condition that causes dark, velvety patches to appear on the skin, often in body folds and creases like the neck, armpits, or groin. These areas can become more pronounced over time if not addressed. These patches might feel slightly thicker or softer than the surrounding skin. They can sometimes be itchy or have a different texture, making them noticeable to the touch. What's interesting is that Acanthosis nigricans is closely linked to insulin resistance, a key feature of type 2 diabetes. Insulin resistance means the body's cells are not responding properly to insulin, which is crucial for regulating blood sugar levels. Remember how we talked about insulin being like a key? This key is supposed to help glucose enter the cells, providing them with energy. Well, when there's insulin resistance, the body's cells aren't responding to insulin as they should, leading to a buildup of glucose in the blood. This excess glucose can cause various health issues, including changes in the skin. This, in turn, can trigger changes in skin pigment cells, resulting in Acanthosis nigricans. By paying attention to these skin changes, we can catch early signs of insulin resistance and take steps to manage our health more effectively. Have you ever experienced tingling, numbness, or even pain in your hands or feet? While these sensations can be caused by various factors, they can also be a red flag for diabetic neuropathy, a type of nerve damage that can occur as a complication of diabetes. High blood sugar levels, if left unchecked over time, can damage the delicate nerves in our extremities, leading to these uncomfortable and sometimes painful sensations. Think of it like this. High blood sugar is like a steady stream of wear and tear on your nerves. Over time, this can disrupt the nerve's ability to send signals properly, leading to reduced sensation, tingling, or even pain. It's important to catch diabetic neuropathy early on, as early detection and management can help slow its progression and prevent further nerve damage. Chapter 6. Beyond tired fatigue as a sign of diabetes. We all feel tired from time to time, right? It's a common experience, especially after a long day or a poor night's sleep. But when fatigue becomes a constant companion, it's important to pay attention, as it could be a sign of something more serious, like diabetes. Persistent fatigue can interfere with daily activities and overall quality of life. You see, our bodies rely on glucose, a type of sugar, for energy. Glucose is the primary fuel that keeps our cells functioning and our bodies moving. When we eat, our bodies break down carbohydrates into glucose, which then enters our bloodstream. This process is essential for providing the energy we need to perform everyday tasks. Insulin, a hormone produced by the pancreas, acts like a key, allowing glucose to enter our cells to be used for energy. Without insulin, glucose would remain in the bloodstream, unable to fuel our cells. However, in diabetes, either the pancreas isn't producing enough insulin or the body's cells aren't responding to insulin properly, a condition known as insulin resistance. This disrupts the normal process of glucose entering the cells. This means that glucose can't enter the cells efficiently, leading to a buildup of sugar in the bloodstream while our cells are starved for energy. The body is unable to utilize the glucose properly, causing an energy crisis at the cellular level. This energy deficit can manifest as persistent fatigue, even if you're getting enough sleep and maintaining a healthy lifestyle. It's a type of tiredness that doesn't go away with rest and can be a significant indicator of an underlying health issue like diabetes. Chapter 7. Blurred vision, a surprising symptom of diabetes. Our eyes are precious, and any changes in vision should never be ignored. While blurred vision can have various causes, it can also be a surprising symptom of diabetes. You might be wondering, what's the connection between blood sugar and our eyes? Well, it all comes down to how our bodies regulate fluid levels. When blood sugar levels are consistently high, it can create an imbalance of fluids in the body, including the eyes. Think of it like this. High blood sugar acts like a sponge, drawing fluid from various tissues, including the lenses of our eyes. This can temporarily change the shape of the lens, making it difficult for the eye to focus properly, resulting in blurred vision. The good news is that these vision changes are often reversible with proper blood sugar management. Chapter 8. Frequent urination, a telltale sign. Frequent trips to the bathroom, especially during the night, can be a real sleep disruptor. While there are many potential causes for increased urination, it can also be a telltale sign of diabetes. Here's why. Our kidneys play a crucial role in filtering waste products from our blood, including excess glucose or sugar. When blood sugar levels are consistently high, like in the case of undiagnosed or poorly managed diabetes, the kidneys go into overdrive trying to filter out all that extra sugar. This leads to increased urine production, as the body tries to flush out the excess glucose, resulting in more frequent urination, both during the day and night. So if you're noticing a significant increase in your bathroom breaks, especially if it's disrupting your sleep, it's essential to talk to your doctor about getting your blood sugar levels checked. Outro. Listen to your body. Early detection is key, so there you have it, 8 potential warning signs of diabetes in women that should never be ignored. Remember, recognizing these signs early on is crucial for effective management and preventing complications down the road. It's essential for women to tune into their bodies and consult with healthcare professionals when these signs emerge. Early detection not only helps manage diabetes more effectively, but can also prevent potential complications that can arise from uncontrolled blood sugar levels. So make sure to watch this video for steps to prevent these signs, and please subscribe to this channel if you found this video helpful. Thank you for watching.